This video describes the technique for all-inside repair of bucket handle meniscus tear. This preoperative T1 sagittal MRI image shows a displaced medial bucket handle meniscus tear. This is the left knee. The medial meniscus tear is viewed through the anterolateral portal, and the anteromedial portal is initially used as the working portal. The tear is prepared by rasping to promote healing. The all-inside device used is the Fast Fix 360 from Smith & Nephew. The all-inside device is introduced from the anteromedial portal to place the first stitch, a horizontal stitch at the junction of the posterior horn and body of the medial meniscus with the left limiter set at 18 mm. A second all-inside device is introduced from the anterolateral portal to place a vertical stitch in the body of the medial meniscus with the depth limiter set at 16 mm. A third all-inside device is introduced from the anteromedial portal to place a horizontal stitch to the posterior horn of the medial meniscus with the depth limiter set at 18 mm. A fourth all-inside device is introduced from the anterolateral portal to place a second vertical stitch in the body of the medial meniscus with the depth limiter set at 16 mm. A fifth all-inside device is introduced from the anterolateral portal to place a third vertical stitch in the body of the medial meniscus at the apex of the tear with the depth limiter set at 16 mm. This stitch is important to prevent tear propagation. We advise using at least 5 to 6 stitches for the all-inside repair of bucket handle meniscus tears. These stitches should be placed in the meniscal tissue with the best quality. The repair is completed and inspected for stability. This image shows an arthroscopic image taken 6 weeks post-repair during interval ACL reconstruction. It shows stable healing of the meniscus repair. A follow-up MRI scan of the knee at 2-year interval shows good healing of the repaired medial meniscus bucket handle tear with no re-displacement. The patient had good functional recovery and was able to return to sports. We now go through tips for reduction of bucket handle meniscus tear to facilitate an all-inside bucket handle meniscus tear repair. In chronic tears, the scar tissue around the displaced meniscal tear fragment can hold the fragment back and prevent reduction. We perform release of this scar tissue via radiofrequency ablation to aid reduction. Scar tissue in the gutter between the bucket handle tear fragment and the peripheral rim can also block reduction. We debride the scar tissue with the use of a radiofrequency device and an arthroscopic shaver. After debridement, the bucket handle tear fragment can be reduced and is ready for all-inside repair. For tears where reduction cannot be maintained, to allow placement of the all-inside stitches, an inside-out reduction stitch can be placed and used to hold reduction. A 30-degree zone-specific cannula is used to place an inside-out suture in the mid-body of the medial meniscus, after which the holding stitch can be tensioned to keep the meniscus fragment reduced as the all-inside sutures are placed in the posterior horn. This reduction suture can be subsequently removed or can be used as an additional fixation. With the tips described in this video, an all-inside bucket handle meniscus repair can be performed with good outcomes.